with regard to acne patients, teenagers obviously, as we all know, can be very non-compliant in their treatments. So the initial consultation for an acne patient, I would always encourage the parents obviously to come with the patient, and the use of the Woods light once again is very useful for acne patients because you can see how well they're cleansing, you can see if they've got blocked pores, there's a sort of a level of fluorescence that occurs on the skin if they're not complying with their treatment plan. So having those before and after photos is really important. So an acne patient, you'd like to get them on a routine of LED light therapy, some oral antibiotics and some topical retinoids, as well as good sunscreen and good skincare, and then perhaps see them back in about 6 or 8 weeks. If they're not complying, it'll be evident on the before and after photos and under the Woods light. And at that stage, their parents can perhaps intervene and sort of encourage them to cleanse better. But I've found that in that approach with the parent and the child working together, we get good results and they're usually compliant. Another important thing with acne patients is to ask about what's happening at home with their diet, because a lot of teenage boys particularly are using energy supplements or perhaps doing too much soft drink. And unless you ask the question, find out what their diet's like, are there a large carbohydrate load and sugar load happening? These are all contributing factors that may mean that their treatment isn't working. So really get a thorough history with an acne patient first so that you can sort of establish those guidelines that they've got to do things at home as well as what we prescribe them. With the LED light therapy, it's important to make sure they get their package of lights up front, not just coming back for ad hoc LED treatments and then saying it hasn't worked, because it needs to be done in a sort of a sequential manner over about 4 to 6 weeks. And if they don't do that, they won't see the results. And the most important thing I think is with patients is to say that nothing's going to work overnight. It often takes 6 to 8 weeks to see improvement in your skin after an acne treatment protocol, so they've really got to be patient and warning about that up front. And also warning them that perhaps during LED light therapy you may go through a bit of a purge where the skin actually appears to be worse before it gets better. So all of these things are important in ensuring compliance and in making sure that they're seeing results. If you're just using oral treatments, oral medications, and that perhaps they're not cleansing and they're not using sunscreen appropriately, they're all things you're going to have to ask as to why it's not working. But I think if they follow the complete comprehensive plan, there's very few patients we do not get results with. If you aren't seeing much improvement, you've really got to think that patient needs to be referred to a dermatologist for Roaccutane or more treatments that can be offered in the consultant dermatologist setting. General practitioners in Australia are unable to prescribe Roaccutane unless you live in a very rural and remote area and you've got some special dispensation. So in Tasmania, no, I do not prescribe Roaccutane. I think the problem for acne patients is access to a dermatologist soon enough. If you leave a patient too long, wait in our state particularly is about 8 to 9 months to get into a consultant dermatologist. So one thing that did come out of COVID, which was good, was the option of telehealth consult, and I have a number of consultant dermatologists I use now who are happy to do those consults. We've done the workup on the patient, so the Roaccutane script is a simple thing to initiate. But I think as a primary care physician, it's important to know that you need to still follow up that patient even if the dermatologist has initiated the script, because we need to know about side effects for Roaccutane. Primary care physicians are in the best position to be able to manage those side effects perhaps and ensure that compliance is happening as well.